students, today we will discuss intrinsic muscles of the hand. Intrinsic muscles. Intrinsic muscles, these are the small muscles. And there are 20 intrinsic muscles in hand. There are total 20 intrinsic muscles which are present in the hand. These muscles are supplied by C8 and T1 spinal nerves. C8 and T1 spinal nerves, they are dedicated to the intrinsic muscles of the hand. These muscles are arranged in 5 groups. The first group is the thenar muscles. Thenar muscles, they are present below the base of thumb. See this muscular part, this muscular elevation is known as the thenar eminence, which is formed by the thenar muscles. So thenar muscles, these are 4 in number. And what are the name of thenar muscles? Number 1, adductor pollicis. Number 2, flexor pollicis brevis. Number 3, opponens pollicis. Number 4, abductor pollicis brevis. These are the 4 muscles come under thenar group. Now the questions are asked regarding their nerve supply. The adductor pollicis muscle, it is supplied by ulnar nerve. Deep branch. The root value of the deep branch of ulnar nerve is C8 T1. Rest of the 3 muscles, they are supplied by median nerve. And the branch of the median nerve supplying these 3 muscles, its root value is C8 T1. So I told you in the beginning, all intrinsic muscles, they are supplied by C8 T1 spinal nerves. The root value will be same, C8 T1. The name of the nerve will change, but the root value will remain same in case of intrinsic muscles of the hand. Now the functions are clear. Adductor pollicis, it causes adduction of the thumb. Flexor pollicis brevis cause flexion. Opponens pollicis cause opposition of the thumb. And abductor pollicis, it cause abduction of the thumb. See the movement of the thumb, this is the abduction, this is adduction. Abduction, adduction. Abduction, adduction. This is flexion, this is extension. Flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. This is the abduction, adduction. Abduction, adduction. And this is the opposition. When thumb touches the tip of fingers, this is opposition movement. So these are the thenar group of muscles. Second group is the hypothenar group. This hypothenar group, this muscular part or elevated part at the medial bottom of the hand, below the little finger. This is hypothenar group. This is hypothenar. This part, hypothenar group of muscles. This is thenar group of muscles. This is hypothenar group of muscles. So second is the hypothenar group of muscles or hypothenar muscles. These are 4 in number and their name is Flexor digiti minimi. Number 2, opponens digiti minimi. The third, palmaris brevis. Number 4, abductor digiti minimi. These are the 4 muscles of the hypothenar group. To keep in mind their name, we can make a mnemonic with the help of acronym. This is HOPA. Digiti minimi means the little finger, and pollicis means the thumb, brevis means small. Now see what is the nerve supply of these muscles. These muscles, they are supplied by the ulnar nerve, deep branch, root value C8T. This and this. While palmaris brevis, this muscle, this is supplied by the ulnar nerve, superficial branch, root value C8T1. So these are the nerve supply of hypothenar group of muscles. The third group, these are lumbricals. So these are 4 in number and they are arranged from lateral to medial side. Every counting in the hand begins from the thumb side, whether it is the carpal bone, metacarpal bone, and now the lumbricals. So lumbrical 1, it is inserted at index finger. No lumbrical for the thumb. So first lumbrical is for the index finger. Lumbrical number 2, it is inserted at the middle finger. Lumbrical 3, it is inserted at the ring finger. And lumbrical 4, it is inserted at the little finger. These are the 4 lumbricals. So lumbricals, first lumbrical is inserted in the dorsal digital expansion of the index finger. No lumbrical at the thumb. So from lateral to medial side, lumbrical 1, lumbrical 2, lumbrical 3, lumbrical 4. We see what is the nerve supply of these lumbricals. The lumbrical 1 and 2, they are supplied by median nerve. The branch of the median nerve, root value C8T1. Lumbrical 3 and 4, they are supplied by ulnar nerve, deep branch, and their root value is C8T1. Clear? So these are the root value of lumbricals, the nerves supplying to the lumbricals, their root value. Now the next is what is the origin. These muscles are important. Their origin, the lumbricals, they originate from the tendon of flexor digitorum profundus muscle. They originate from the tendon of flexor digitorum profundus muscle, FDP muscle. See the flexor digitorum profundus muscle, its tendon, it divides into the 4 slips to get inserted into the 4 fingers. The muscle bearing the word digitorum, its tendon divide into the 4 parts because the number of fingers in the hand 4. Number of toes in the foot, they are 4. So digitorum muscle, whether flexor digitorum or extensor digitorum, it divides into the 4 parts. Here the FDP muscle, the tendon of the flexor digitorum profundus muscle, it divides into the 4 slips, and these 4 slips, they give origin to the lumbricals. Yes. Lumbrical 1, lumbrical 2, lumbrical 3 and lumbrical 4. So these are the 4 lumbricals. So see, first and second lumbrical, they are unipinnate muscle. First and second lumbrical, because the fibers are arising in a single direction. Lumbrical 3 and 4, they are bipinnate muscles because fibers are arising in 2 directions. So this is the difference, lumbrical 3 and lumbrical 4. They are bipinnate muscle. Unipinnate muscle is like this. This is the tendon. See this. If fibers are arising in one direction, fibers are coming from one direction, this muscle is unipinnate muscle. If fibers are coming from 2 directions, then this is the bipinnate muscle. So lumbrical 1 and 2, they are example of unipinnate muscle. Lumbrical 3 and 4, they are example of bipinnate muscle. Now the next question, what is the action of lumbricals? The action of lumbricals, they cause flexion at MP joint. They cause extension at IP joint. IP joint, this is the PIP joint and this is the DIP joint, both. So MP joint is the metacarpophalangeal joint. IP joint is the interphalangeal joint. So interphalangeal joint is the PIP joint and the DIP joint. So this is about the lumbricals. The 4th group is the palmar interossei. And the 5th group is the dorsal interossei. Palmar interossei, these are 4 in number. Dorsal interossei, these are also 4 in number. So palmar and dorsal interossei, these are 2 different groups, but they have some common features. What are those? The common features. First is the origin. They originate from the shaft of metacarpus. Insertion. They are inserted in dorsal digital expansion. Then what is the nerve supply? This palmar interossei and dorsal interossei, they are supplied by the ulnar nerve, deep branch. Then what is the action of these muscles? So 3 features are common in palmar and dorsal interossei. They have the common origin from the shaft of metacarpals, insertion, common insertion, dorsal distal expansion of fingers. Nerve supply is the ulnar nerve deep branch. All 8 muscles supplied by the ulnar nerve. So what is the difference? Difference first in the location. Palmar interossei present on the palmar surface of the hand. Dorsal interossei, they are present on the dorsal surface of the hand. The next is the action. What is the action? Palmar interossei, its action is with the help of mnemonic PAD pad, while dorsal interosseids action is DAB dab. So palmar interossei, they cause adduction of fingers. Adduction of fingers. Dorsal interossei, they cause abduction of fingers. Dorsal interossei, they cause abduction of fingers. Palmar interossei, they cause adduction of fingers. So see, adduction. This is the adduction and this is the abduction. The spreading of the fingers is abduction, and this collection of fingers, adduction. Abduction. Adduction. Abduction. Adduction. So PAD pad, palmar interossei, cause adduction of fingers. DAB dab, dorsal interossei, cause abduction of fingers. Another point, B. B for bipinnate. B for bipinnate. It means dorsal interossei, these are the bipinnate muscle, while palmar interossei, they are unipinnate muscle. So these are the intrinsic muscles of the hand. Next is the blood supply of hand. The blood supply of the hand is supplied by two arterial arches. Their name are, number 1, superficial palmar arch. And the second one is the deep palmar arch. Superficial palmar arch and deep palmar arch. These are the two arterial arches which supply blood to the hand. These two arches are formed by two arteries. What are the name of these two arteries? Number first is the radial artery, and the second one is the ulnar artery. These two arteries, radial artery and the ulnar artery, these are the terminal branches of brachial artery. Where do they arise? They arise in cubital fossa. At what level? At the level of neck of radius. At the level of the neck of radius, this brachial artery, it terminates by dividing into two branches, radial artery and ulnar artery. Radial artery runs laterally, ulnar artery runs medially. This radial artery, it is most commonly examined artery. So its relations are important. It is examined here in the lower 1/3 of the radius or in the lower 1/3 of the forearm. So what are the lateral relation and what are the medial relation of radial artery? Laterally is present tendon of brachioradialis, and medially is the tendon of Flexor carpi radialis. So this radial artery runs in the forearm between the tendon of brachioradialis laterally and the medially tendon of Flexor carpi radialis. This is most commonly examined artery. Peripheral pulse examination is done by radial artery. Up these two arteries, they form two arterial arches, but one artery is main in each palmar arch. Like deep palmar arch, it is formed by ulnar. It is formed by radial artery. Deep palmar arch, it is formed by radial artery. How will you keep in mind? With the help of a mnemonic RDX, radial artery form deep palmar arch. So it is formed by radial artery. So superficial palmar arch, it is formed by the ulnar artery. Superficial palmar arch, this is formed by ulnar artery. So easy to remember with the help of mnemonic RDX, deep palmar arch formed by radial artery. Radial artery is present laterally. So see the deep palmar arch. It is like this. This is the deep palmar arch. So it is the radial artery. So deep palmar arch, it is formed by the radial artery and completed medially, because radial artery present laterally. So it is completed medially by deep palmar branch of ulnar artery. Both arterial arches are formed by the contribution of both the arteries. In deep palmar arch, main artery is the radial artery, which is present laterally. So this arterial arch needs completion on medial side, and it is completed by the deep palmar branch of ulnar artery. The same concept is in the superficial palmar arch. It is formed by the ulnar artery and completed laterally by superficial palmar branch of radial artery and completed laterally by superficial palmar branch of radial artery. So these are the two arterial arches, superficial palmar arch and the deep palmar arch. These arches, they give branches for the digits. Now another question, why superficial palmar arch is superficial? The superficial palmar arch, it is superficial in position. So it is superficial to long flexor tendons. Superficial to long flexor tendons and lumbricals. While deep palmar arch, it is deep to long flexor tendons and lumbricals. What are the long flexor tendons? The long flexor tendons are the flexor digitorum superficialis, tendon of flexor digitorum superficialis, tendon of flexor digitorum profundus, tendon of flexor pollicis longus. These are the long flexor tendons. FDS, flexor digitorum superficialis. FDP, flexor digitorum profundus. FPL, flexor pollicis longus. So when the arterial arch, it is superficial to long flexor tendons and lumbricals, it is the superficial palmar arch, and when it is deep to the long flexor tendons and lumbricals, it is the deep palmar arch. Another question can be asked, what is the position of arterial arches in the hand? Look at the thumb. This is the extended thumb. It has two borders, proximal border, and this is the distal border. So at the level of proximal border, it is the deep palmar arch. At the level of distal border, this is superficial palmar arch. So see the level in hand. The superficial palmar arch, it is present at distal border of extended thumb, while deep palmar arch, it is present at proximal border of extended thumb. Now what are the branches? Branches, they give common digital arteries. Both arterial arches combinedly give common distal arteries. Plus, they give princeps pollicis artery. They give radialis indicis artery. Princeps pollicis artery, radialis indicis artery. So pollicis means the thumb and radialis indicis, this is the index finger. So these two, princeps pollicis and radialis indicis, these two arteries, they are supplied by the, these are the branch of deep palmar arch. These are the branch of both superficial and the deep palmar arch. But princeps pollicis and radialis indicis, these are the branches of deep palmar arch only. Why? These two, they two, thumb and the index finger, they present laterally. Laterally present the radial artery. Radial artery form the deep palmar arch. So easy to remember, princeps pollicis and radialis indicis, they are branch of radial artery, that is the deep palmar arch. Now the next point is the next heading is the nerve supply of hand. So as you see, hand has two surfaces. This is the palmar surface and this is the dorsal surface or the dorsum of the hand. So the sensory nerve supply of the palmar surface, palm. This is the thumb. So this is the lateral side and this is the medial side. So sensory supply of the palmar surface of the hand. For that purpose, we divide the palmar surface into two parts, the lateral 3.5 and medial 1.5. This is lateral 3.5 and medial 1.5. 3.5 and this is the 1.5. So medially 1.5, this is supplied by ulnar nerve, and laterally 3.5, this is supplied by median nerve. This is the sensory supply of the palm. Now see the dorsum of the hand. Sensory supply of the dorsum of the hand. So I am drawing the hand. This is the thumb, then index finger, middle finger, ring finger and little finger. Yes, these are the nail pads. So this is the thumb present laterally and this is present medially. So what we do, the dorsum of the hand is divided into two equal halves. This is 2.5, this is 2.5. The lateral 2.5 and the medial 2.5. This dorsum of the hand, it divides into two equal halves. The lateral 2.5 and the medial 2.5. This lateral 2.5, this is supplied by the radial nerve, and this medial 2.5, this is supplied by the ulnar nerve. And now the pointage is skin above PIP joint. Skin above PIP joint, 4. Lateral 3.5 digits. Supplied by median nerve. It means this: skin above the PIP joint for lateral 3.5 digits. This is supplied by median nerve. This is supplied by median nerve. For remaining 1.5 digit. This. For remaining medially 1.5 digit, this is supplied by ulnar nerve. This is supplied by the ulnar nerve. So this is the sensory supply of the hand. So which finger has maximum nerve supply? This is the ring finger, or the nail bed of the ring finger is supplied by two nerves. The lateral half supplied by the median nerve, and the medial half it is supplied by the ulnar nerve. This is the lateral side, so lateral half supplied by median nerve, medial half supplied by the ulnar nerve. Nail bed of the thumb, it is supplied by the median nerve. The nail bed of the little finger, it is supplied by the ulnar nerve. See this is the dorsum of the hand. See, it is supplied below the PIP joint. It is divided into two halves, 2.5 and 2.5. This is 2.5. This is 2.5. So it is supplied by the radial nerve, and this is supplied by the ulnar nerve. Now skin above PIP joint for lateral 3.5 digits. It is supplied by the median nerve. Remaining 1.5 digit. This is supplied by the ulnar nerve. This is supplied by the ulnar nerve. At the this is the palmar surface. We divide it into, this is the lateral 3.5, medial 1.5. So this is supplied by the median nerve, and this is supplied by the ulnar nerve. This is the median nerve. This is ulnar nerve. So this is the sensory nerve supply of the hand. Another questions: what are the dermatomes present in the hand? So dermatomes, this is the area of skin supplied by single spinal nerve. This is the area of the skin which is supplied by single spinal nerve. This is known as dermatome. One question: C1 nerve has no dermatome. It means it does not supply to the skin. Now, what dermatomes present in hand? Dermatomes in hand. So, what dermatomes present in the hand? C6 dermatome present in the thumb. C7 dermatome, it is present in the index finger, middle finger, and ring finger. And C8 dermatome, it is present in the little finger. Clear? So these are the dermatomes in hand. This is all about the nerve supply of the hand. Thank you so much.